My team and I at Curewize would like to ask you to help us save and improve the quality of life of young cancer patients. Do you know that the leading cause of death by disease in children and adolescents is acute lymphoblastic leukemia? Knowing this, can you imagine being told your child has leukemia, or that instead of fun and games, the child's life will be full of hospital stays, chemotherapy, and radiation? Not only will the child suffer from the immediate debilitating effects of toxic treatment, but also has a very high risk of lifelong medical conditions and secondary cancers caused by injury to healthy growing cells. That's why it is so important to the pediatric oncologist to treat ALL patients according to their personal need, so they may benefit from the therapy with the least amount of injury to healthy cells. Today's gold standard for choosing the ALL patient's treatment is MRD, which measures the patient's response to their initial treatment. So the next treatment cycle would be either standard or intense. The problem is MRD results are only in 1 to 3 months after receiving therapy, and the patient can be unnecessarily exposed to high amounts of toxic treatment. And also the window of opportunity to save some severe patients can be missed. MRD has questionable long-term monitoring ability. 50% of patients that relapse have a new leukemia cell not detected by MRD. That's why medical professionals agree that there is a need for a better predictive assay for ALL. Schneider's Children's Medical Center of Israel created ProALL, a new state-of-the-art prognostic assay for ALL. ProALL results are available within 3 days of diagnosis instead of 1 to 3 months. With ProALL, the window of opportunity to save the lives of severe patients will not be missed. An unnecessary high dosage of toxic treatment that can cause very serious medical conditions can be avoided. ProALL was also shown to have monitoring ability. Levels rise after treatment and during remission, but decrease during and before disease relapse. But we need further proof to translate ProALL to clinical practice. That is why we are asking funding from you. Funding we receive from you will go towards additional clinical trials for ProALL's regulatory approval and translation to clinical practice, which will be via CE in Europe, via a CLIA lab in the USA, and finally through FDA approval. ProALL will take a 20-year-old art form to the state-of-the-art of the 21st century. ProALL benefits physicians that can now treat patients accurately from the start. Pharmaceutical companies can use the ProALL test to help develop new treatments. Most importantly, young cancer patients will be able to grow into healthy adults. And you will know that you are funding a project that will help young cancer patients grow into healthy adults.